demonstrate how to assist residents with meals. Food and nutrition are an important part of life. Nutrition and hydration affect residents' quality of life and quality of care in many ways. Good nutrition and hydration help maintain skin integrity, help the body fight infections and disease, maintain residents' overall strength and functional abilities, and maintain normal bowel and bladder functions and normal weight and energy stores. When people age or become ill, however, their appetite often changes. This can create a challenge for their care. One of your most important duties as a nurse assistant is to help your residents with meals. Although you might think this is a simple matter of common sense, it actually requires a lot of attention. Your ability to do it well directly affects residents' nutritional status. Remember all the steps to be aware that you learned in the opening video as you prepare to assist the resident with their meal. Residents more fully enjoy their meals when they are properly prepared. Before the meal, help your resident as needed with grooming, hand washing, oral care, and toileting.
And look good. Okay, good. Have your mirror. Let me help you assist.
Encourage your residents to use their dentures, glasses, and hearing aids. These devices improve residents' functional abilities and help them be more independent. Help your residents to the dining room or make them comfortable in their room. If possible, transfer them from their wheelchair to a dining room chair. Residents should sit upright at a 90-degree angle with their feet touching the floor.
Miss Berry, are you okay?
I'm fine, Seth. Thank you.
You're welcome. I'm going to wash my hand. I'll be back in a minute, okay?
Thank
Before assisting with a meal, wash your hands thoroughly. This is an important part of infection control. Make your residents as comfortable as possible. Use clothes protectors or napkins to protect their clothing. Pass trays as quickly as possible to be sure cold foods are still cold and hot foods hot. Put yourself in your resident's place. How would you feel if you were hungry and your tray was ready, but no one came to serve it for 20 or 30 minutes? When you remove the tray from the cart, first check the diet card. This tells you which tray goes to which resident. Make sure the tray is meant for your resident and make sure the diet appears correct. Remove the food from the tray. Put the plate directly on the table for a more home-like appearance. Remove any covers and underliners from the plate unless the person is not ready to eat, and put them back on the tray in the cart. Remove any plastic wrap, lids, or foil. Open condiments and cartons. Ask your resident if they want assistance in cutting and seasoning their food. Encourage your residents to express their choices. While serving the meal, describe the menu enthusiastically. Like you, your residents prefer familiar foods. Their preferences may be based on personal, religious, regional, or ethnic factors. Make sure your resident is close enough to the table to reach her food and utensils, and give her any help she needs, such as cutting her meat or other food. Encourage her to be as independent as possible, but watch for residents who need help. If you cut the meat for her, cut it in small pieces to prevent choking. After you have served the first resident at the table, move on to other residents at the same table. Serve all residents at a table before moving on to the next. It is frustrating to watch others eat and maybe even finish their meal while you're still waiting. Such a delay detracts from the social pleasure of eating together. After you've served residents, check with them often to offer further help as needed or to encourage them to eat. Some residents respond to prompting. Some residents eat much more slowly than others.
How's it going? Is it okay? Oh, okay. Okay.
If your resident does not eat well or rejects a particular food, offer to get a substitute. Every resident has the right to expect a substitute for something they do not want to eat. Residents should never leave the dining room hungry or be given food they cannot eat. Be sure your resident has enough time to finish their meal. Remove the tray and make sure each resident's hands and face are clean and that they're comfortable.
Thank you.
Make sure you understand your residents' needs and review the ending steps that you learned in the introduction video. This helps to ensure that you make the accommodations needed to complete every procedure. Mealtime is much more than eating. Mealtime should be pleasurable and enhance your residents' well-being. Attractive surroundings, pleasant company, and courteous service all increase residents' enjoyment of their meals. As a nurse assistant, you will have a key role in ensuring this for your residents.